So prior to watching the video of what keeps nurses up at night, I made my own list. Um, my number one on that list was the staff's shortages that everywhere is facing and how it affects patient care. I think about this frequently, and I have seen it everywhere. Every hospital I've done clinicals at work, everything, and I just see how negatively it affects patients. That was mentioned in the video. The other thing that I wrote down on my list was when patients don't have resources or the ability to receive the outpatient care that they need to continue to follow up on their conditions. I worked on a cardiac floor. A lot of people didn't have insurance, couldn't get to the doctor, and so we would see them repeatedly and repeatedly simply because they didn't have the means. That was mentioned a couple different ways in that video and was something I've been able to relate to. The last thing that I had on my list was one thing that I have seen since COVID started, and that is the restriction of visitor policies. And when we would have our COVID patients, how lonely their dying process was, just being alone and separated from everyone that they cared about. I thought about that so much and how almost unhumane it sounded, because I could not imagine being in a position where I was passing and I couldn't even, or somebody I loved was passing and I couldn't provide comfort to them or receive comfort from the people that you would want to be there in your final days, hours, minutes, whatever. And even at some hospitals, we have restrictions on who can come, how long that they can come. And I know in some cases, like, you get one or two visitors and it has to be the same visitors the entire stay. And even though we can provide accommodations, I just think that, and frequently think about how hard that must be to not be able to have your loved ones around as you can in the hospital because of visitor restrictions. I think that part of healing is physical, mental, emotional, and spiritual, and you have to have the whole thing to get really good healing. And I think that this affects our social, this affects our emotional and our mental health, and that all in turn affects our physical. And so I think these visitor policies, and I know we're trying to limit things, but having somebody need to be on comfort care before they can have all of their family up with them just seems a little inhumane and a little bit counterproductive when we're trying to heal these patients.